This section demonstrates obtaining pressures and waveforms. Pressures are obtained using the Doppler probe or the photoplethysmography probe, also known as a PPG probe. We'll begin using the Doppler probe to obtain the systolic brachial pressure. Connect the pressure hose to the fitting on the right brachial cuff. Apply a small amount of gel over the artery and place the Doppler probe at approximately 45 degrees, pointing in the direction towards the shoulder. Slide the probe laterally across the arm to find the artery and obtain the best signal possible. You may want to adjust the volume to acquire a proper audio level. Once the best signal is obtained, brace the hand holding the probe against the patient's arm to ensure a stable position. Be careful not to apply too much pressure against the skin, which could occlude the artery. Next, press and hold pump to inflate the cuff. Release the key once the pressure reaches about 20 millimeters of mercury above the occlusion pressure, and the cuff will automatically deflate. Press Save when you hear the first pulsation return. If you are late pressing Save, adjust the pressure reading by using the up or down key. Press Save to record the systolic pressure, and the marker will move to the next protocol location. The diagnostic value of the ABI is enhanced by the analysis of lower extremity waveforms. The VISTA ABS can acquire bidirectional Doppler waveforms, pulse volume recording, or PVR waveforms and PPG waveforms. First, we'll use the Doppler probe to obtain a waveform. Apply gel and place the probe over either the posterior tibial artery or the dorsalis pedis artery. Here we are locating the posterior tibia. Brace the probe on the artery at a 45-degree angle, pointing the probe tip in the direction towards the knee. Slide the probe slowly across the artery until the best signal is obtained. Press Scale one or more times as needed to adjust the vertical scaling to obtain a waveform as large as possible without clipping at the top. The majority of the waveform will be above the baseline. Press Save when you have acquired an acceptable waveform. Press Save again to record it. A normal Doppler waveform is pulsatile and multiphasic. The systolic upstroke is rapid, and the waveform drops rapidly after a well-defined peak. This is a normal triphasic waveform. There are two diastolic components. The first is below the baseline, indicating flow receding from the probe. The second is above the baseline, indicating flow towards the probe. This is a biphasic waveform from a normal patient. The second diastolic component is absent, but all other aspects of the waveform are normal. Absence of the second diastolic component without additional evidence is not an indication of disease. The Doppler waveform's rise and fall times lengthen as disease progresses. A long deceleration is an indicator of PAD. With moderate disease, the waveform becomes monophasic. The weak signals associated with diminished flow often produce waveforms that are jagged in appearance. Next, we'll use PVR to obtain a waveform. Move the hose to the right ankle and connect it to the cuff. The marker should be located at either the right or left wave site. Press and hold pump to inflate the cuff to 75 millimeters of mercury. Release when the inflation automatically stops. Pressure will deflate to 65 millimeters of mercury for optimum PVR. Wait for the cuff deflating message on the display to disappear. If needed, use the scale key to optimize the waveform. After the waveform stabilizes, press Freeze. Here you have two options. If the waveform is acceptable, press Save to record it, or use the up or down key to scroll to the optimum waveform, then press Save to record it. Press Save again to move to the next protocol location. A normal PVR waveform resembles the arterial pressure pulse as shown here. The normal waveform has a sharp systolic upstroke and a relatively narrow, well-defined peak. After peaking, the waveform drops quickly during diastole. There is a noticeable diastolic notch. This is an example of an abnormal PVR waveform. Distal to an arterial occlusion, the waveform becomes more rounded. The rise and fall times are extended and the peak is less pronounced, and the diastolic notch is missing. Now we'll demonstrate obtaining ankle pressures. In this example, we are using the Doppler probe. Apply gel over the artery and position the Doppler probe over the posterior tibial artery or the dorsalis pedis artery to obtain a good signal. Here we are positioning the probe on the posterior tibia. Press and hold pump to inflate the cuff. Release the key once the pressure reaches about 20 millimeters of mercury above the occlusion pressure, and the cuff will deflate. Press save when you hear the first pulsation return. If you were late pressing save, adjust the pressure reading by using the up or down key as shown. Press save to record the systolic pressure and the marker will move to the next protocol location. With the Vista AVS, the PPG probe is used for obtaining toe pressures for TBI exams and can be used for obtaining brachial and ankle pressures for ABI exams. The PPG probe can also be used to obtain lower extremity pressures for segmental studies. First, we'll demonstrate using the PPG for toe pressures. Wrap the great toe with a 2.5 centimeter or 1.9 centimeter digit cuff and attach the pressure hose. The cuff should be 40% of the toe circumference. Place the cuff at the base of the toe. Attach the PPG probe to the toe distal to the cuff, with the blue side of the probe against the skin. The probe should be snug to ensure contact, but not so tight that blood flow is occluded. The ankle cuff is not used while taking toe pressures. The patient must be still to acquire a PPG signal. Wait a few seconds for the PPG waveform to stabilize after applying the probe. Press Scale one or more times as needed to adjust the vertical scaling to obtain a waveform as large as possible without clipping at the top. Once a stable PPG waveform is obtained, press Pump to inflate the digit cuff. Continue to inflate to a pressure approximately 20 millimeters of mercury above the pressure where the PPG pulsations disappear. The digit cuff will begin to deflate automatically once the pump stops. Press Freeze after several pulses have reappeared. Press the up or down key to move the caliper tool to the beginning of the first upward slope at the start of the pulsation, as shown. This is the systolic pressure. Press Save to record the pressure, and the marker will move to the next protocol location. Now we'll demonstrate using the PPG probe to obtain brachial pressures. Apply the PPG to the tip of the index finger as shown. Again, be sure the probe is snug but not too tight. Connect the pressure hose to the fitting on the right brachial cuff and wait a few seconds for the PPG waveform to stabilize after applying the probe. The patient must remain still. Press Scale to optimize the waveform on the display. Once a stable PPG waveform is obtained, press Pump to inflate the cuff. Continue to inflate to a pressure approximately 20 millimeters of mercury above the pressure where the PPG pulsations disappear. The cuff will begin to deflate automatically once the pump stops. Press Freeze after several pulses have reappeared. Press the up or down key to move the caliper tool to the beginning of the first upward slope at the start of the pulsation, as shown. This is the systolic pressure. Press Save to record it, and the marker will move to the next protocol location. To obtain PPG pressures at the ankle and other lower extremity sites, place the PPG probe on the great toe and apply the cuffs at the various arterial sites to be assessed. Proceed with obtaining the pressures using the Vista AVS as was described for the brachial pressure. For more details for obtaining PPG pressures for the ABI and segmental studies, refer to Section 6 of this video.